Preventive health care is important for adults, but may be even more important for children.
Our guest on this week's Health Talk will discuss the importance of well child visits, so stay tuned.
We are up next. Hello, I'm Dr. Eric Mazer.
And I'm Dr. Andrea Peterson. Today on Health Talk, we're going to talk about well child visits. We're joined by Dr. Lalaine Mortera. She's a pediatrician.
With the Western Connecticut Medical Group, right?
Welcome.
Hi, Andrea.
And you're largely in Newtown, is that right?
Yes, the practice is in Newtown.
Well, tell us a little bit about, I almost think of, that's what you do as a pediatrician,
Yes,
is maintain well children. So why are they important?
Yes, in fact, it is really the pillar and the foundation of a very good well child care. And the reason for the well visits and scheduled visits to go to those visits is to monitor, ongoing health issues and monitor the health of the child.
And in fact, this starts right at birth, doesn't it?
Yes, it starts right at birth, right after the baby's been born and the baby's getting ready to be discharged. We would like to see the child maybe within the 24 and 48 hours after discharge.
Now that's in addition. Don't pediatricians generally see the newborns while they're still in the hospital as well?
There are some people who, we have other providers in our practice, the neonatologists who take over the babies during their visit.
So what are the things you're looking for right at the time of birth? Why is that time important? I know every time is important, but maybe go through some of the different times.
Because the baby is always a surprise. There's always something that we don't know, right? So it's a bundle of joy, but we are not sure if there's any health problems or any impending cardiac, issues or anything like that. So the first week or first 2 weeks is very critical.
Now, I think my impression, I've just recently had several grandchildren, at least my children have had several grandchildren,
Yes.
and it seemed like there was always something that came up that, so the metabolic screen didn't come back totally normal,
Yes.
or one of my granddaughters had ear pits, so there was
Yes,
question about her hearing. It's pretty common to find a little something, even though
Yes.
most of them turn out to not to be too important.
Yes, and in fact that's important because that means that we are really observing the child and we really have all the providers over and over. We have first the neonatologist, and then we have the other healthcare providers within the neonatal IC or the nursery to look at the child. You have a lot of pairs of eyes. You have the nurses, helping out, so to detect any of these surprises that the baby might bring.
Heartmurmurs, I think, are pretty common.
Exactly, and now they do the screening in the nursery. They do the screening for cardiac problems.
They do an echo, or just they listen?
Check the pulse ox. They actually check the
So the oxygen level.
Congenital, cyanotic, or
Yes.
heart disease where there's a
Yes.
shunt of blood.
which we
in
don't
all
want to
directions.
happen at home. That's why we need to keep the baby.
So there are some things that are done right away in the hospital in the
Yes.
first few days of
Yes.
life, both physical exam,
Yes.
and maybe you can talk a little bit about the screening tests that are done, like what's that heel stick thing all
Yeah,
about?
the heel stick is actually a neonatal screening test, so we cannot detect all diseases, but we try to screen as much as we can. Diseases that we can hopefully detect early so we could prevent it from, causing problems.
And then in addition, in the next few weeks of life, what else is a pediatrician looking for to determine how is this baby doing?
There's a lot of things. That's why the health visits are very important because we go through all the aspects of the child's well-being. So we take the height, the weight. If we're going to talk about the well child visits, we do that. We do the health, the height, the weight, head circumference up to 3 years of age.
So you're really looking there to make sure the baby's growing
Yes,
appropriately and eating properly.
Exactly. So we're talking about nutrition. We're talking about sleeping habits. We're talking about stooling patterns.
And remember, there are things, just to point out, there are things that can happen in that period. I think pyloric stenosis is one, which is a blockage of the stomach, which has an easy surgical cure, and yet can threaten the baby's life if it's not detected early. Should also point out, again, so I've lived through it, you come up with a lot of things that turn out not to be anything, to reassure people.
Which is very good, yeah.
Which is
that
good.
means that the screening method is
screening is meant to capture a lot of potential problems rather than to just find people with that problem.
I just want to mention that in the olden days, we used to have the baby stay in the hospital for 1 week, 2 weeks, however much the baby wants. Now, 24 hours. So there's really not much we could, it's very dangerous for us to say, okay, after 24 hours, so I'm sure this baby's fine. No, you need to really watch this child for a whole week, 2 weeks to make sure. But if without the experience of the nurses and other healthcare providers, and we have a brand new, let's say a teenage parent, it's very hard to really, detect. And, so that's why we need to see the child on a regular basis and immediately after they get discharged.
I think that, you bring up a great point, because pediatric care is care not just for the child, but in many ways for the family.
Yes.
And so it's also a time for a parent or parents to come in and ask questions or voice concerns or talk about how things are going. Right?
It's very scary to have a little baby at home. It's funny, and I've parented 2 children, and recently with my grandchildren, where they come to me, I'm still
You can
scared.
read a lot of books
they
and watch
develop
videos, but then it's your baby.
I know,
it's
but
different.
see, the thing is, each child is different. It's individual, right? So you can have a very difficult child at the beginning, for the first child, and then the second child is easier. So it really depends. But that's why you need a partner. That's why pediatricians are your partners. We're not saying we're taking over the healthcare. We're just saying we are empowering the parents to detect, what is really simple cold or what is really important.
How do you know? I know that you weigh the babies and you measure them and you measure head circumference. How do you know that they're growing properly?
So we do have a growth curve that we follow, and it's actually a standardized, chart, and we plot them in, and then we see how they're growing. But if you look at the parents are short and the baby's small, that's still within the norm. You can't
so
expect.
Just because they're low doesn't mean it's as long as they're following
their own curve, right? And in fact, some babies start slow, but if it's on that fifth percentile all the time, then you don't worry. But if that 5th percentile flattens out, then
my son was always in the 5th percentile, and now he's 6'1", but he didn't grow until college. So he was always on the small side.
Right.
What about coming out of infancy? Tell us a little bit about well-child visits in later infanthood and toddlerhood.
So actually we split the well-child visits into general, infancy, meaning 0 to 1, and then early childhood 1 to 5, and then from 5 to 10 would be middle childhood, and then adolescence, right? So there are categories there, but there are different topics that come up with each.
Could you go through those? That would be, I think, a great interest.
Yeah, actually, there's a lot of things like the anticipatory guidance, wherein we actually educate the caretaker or the guardian of what to anticipate for that specific age. And we do have a lot of websites online.
What do you think are some of the most common questions you get asked about early childhood?
Early childhood, is she going to be is she going to be tall? Is she going to be short? Those are the questions. But in terms of behavior,
and how about
temperament,
I was going to say, intellectual development seems to be an important. Monitoring that would seem to be very important as well, because, again, it is not uncommon for children to have perceptual problems, autism spectrum, things that will come out over time. How do you monitor for that?
Yes, so we do have the growth, the checklist for the developmental checklist. So for each age group, we do have this checklist, and we kind of make sure that the child does those expected developmental milestones during that age.
So things like rolling over,
are they rolling
crawling
over on time, right? And then, of course, we do specific screening tests. For example, you mentioned autism. We do have the MCHAT that we use, and we use it around 18 months of age and 2 years of age, wherein we have a way to detect which child needs to be further evaluated for autism or
I've certainly seen it among friends that children who are on that spectrum who get early intervention really can dramatically improve.
Is dramatically
I was sort of shocked. Again, the friend of the family that we've observed, and a little child who was, would make no social contact as a 2-year-old is a healthy 6, 7-year-old. Really.
That is why the screening tests are in place. That is why it is important to really come and see your pediatrician at the right time.
So it's really being proactive instead of only being reactive. So it's in what you said, anticipatory guidance. Here's what you should be seeing. If you're seeing something else, let us know, but being with the parents every step of that way.
And I want the parents to also know that it's not really just, okay, he's not having a cold, he's healthy. No, there's a lot of aspects. You have the emotional, the psychosocial aspects, all those things that you need to go through with the parents, especially with parents, first-time parents. They don't know what to expect. So they really need us to go through all these issues with them. And you'll see in a well-child form, it's really a long list, and we go through everything. We have the nurses go through everything with the moms. If there's anything that's a red flag, we zoom into it and say, yep, there might be a problem, then we have to take care of it.
No, I think immunizations are an important part of well-child care.
Definitely, it's one of the pillars. I don't want to talk in detail,
but maybe you could just list for us some of the diseases that can be prevented today. And I will say this from the standpoint of somebody who grew up, I won't say in the pre-vaccine area, because I got smallpox, which we don't give anymore, and I'm trying to think if I got any else, but measles, mumps, polio were all part of chicken pox were all part of my life.
Yes. And I grew up in the Philippines, so I had seen all those diseases in the whole spectrum. So
and we should point out those are not benign diseases, or they're not always benign diseases. I tutored a family member when I was in college whose child had mumps meningitis and was permanently disabled. Couldn't walk, couldn't talk. It was a tragedy. So these people who think, well, let them get the mumps and let it just happen, they're taking a big risk.
And I think we shouldn't rest on that now we're in, the United States and we're so healthy. Well, because we are still giving vaccines. We are still, monitoring, we're still doing surveillance. But, in other third world countries, they see that in the whole spectrum.
Well, and even in the United States, when vaccine rates drop, we see resurgences of diseases like measles.
We've had epidemics. We have small spurts of epidemics, some dangerous
ones.
Now,
we have some websites that you put together for us where our viewers can go for more information about well child care. These are some of the respected, the American Academy of Pediatrics. Do you want to say something about these as we go forward? Yes,
actually this is a good website for anything that has been followed by thousands and thousands of pediatricians. Brightfutures.org is also a good website. We have healthychildren.org, and it's under the American Academy of Pediatrics.
CDC is the Center for Disease Control. That's the federal website. And you just mentioned healthychildren.org. So these are all places where our viewers can go and make sure their pediatrician's doing the right thing.
Yes.
But we want to say it's never a substitute for having your child see his or her own doctor.
I'd like to say something also about the importance of continuity, because now we have available the internet to look things up. You have walk-ins all over the place who like nothing more than to see a kid with a sore throat or a stuffy nose.
That is the point. That is a very good point, because we're talking about acute diseases versus something that someone that can actually put everything together for you. So if you have a walk-in center and I could go in anytime, every time my child gets sick, but that each and every person is always different, and nobody could really
And a pediatrician will say, gee, you're having more colds than you really should, or your croup is more severe than it should.
It might be something else that's underlying that you might miss.
So I think that, that's not to say anything bad about walk-in clinics, but just recognize they're for a very limited number of diseases, and especially for children, I would think, you lose that continuity and that perspective that you want pediatrician.
I think what will be missing there is, if you don't have a pediatrician, is that there's no relationship that's built. The trust that you build through the years as the child is growing. Eventually that baby's going to be an adolescent. Who does the child go to? To the parents for advice, but you know what? They also have the pediatrician for advice, because we've learned to trust them and they've learned to trust us. So there is a relationship that's
wonderful information, and incredibly we're done for right now, but we really appreciate you coming on to share with us so much information. And it's all we have time for right now, but we'd like to thank our guest, Dr. Lalaine Mortera, for coming on Health Talk today.
And we will see you soon.
Be well.